4. Which of the following is the most likely diagnosis for a 28-year-old man who presented with complaints of backache, morning stiffness, and redness of the eyes, as shown in the X-ray image of the spine below? Your options are. And the correct answer is ankylosing spondylitis. Here's the explanation.
The pathogenesis or inflammation in ankylosing spondylitis starts there, and it undergoes stages of inflammation. It can become bony erosion. Finally, the hallmark is called syndesmophytes. Syndesmophytes, like an osteophyte, a spur formation. You look at this X-ray. This is the vertebral body. This is the vertebral body. Here you are seeing a separate piece of bone. Here you are able to see a separate piece of bone. These, I will rub this. Now you see, zoom and see. They are called syndesmophytes. This is the hallmark of ankylosing spondylitis, dear friends. Okay. Now, coming to clinical manifestations, men are affected 3 times more common than women. Rheumatoid arthritis, women are affected 3 times more common than men. This men are affected more common than women. Typical age of onset is 20 to 30 years. In one book, I read that after 40 years, ankylosing spondylitis will not happen. Just like that, we can't type, okay? Just like that, we can't teach. But that's a study they had. Let us know what is the most common age, 20 to 30. You register this in your mind. Earliest presentation is pain and stiffness in the thoracolumbar region. Low backache, buttocks pain with pronounced morning stiffness. When they get up from bed, pain will be more. The sacroiliac joint and the vertebral body in thoracolumbar area. As they start working, pain decreases. Very classical history of ankylosing spondylitis. Very classical history of rheumatoid arthritis. Finger stiffness more during early morning hours. Where when we continue to work, the finger stiffness comes down. Yes or no? So exactly. There are severe night pain which disturb the sleep. Night cries. We had studied in 2 places, dear friends. Skeletal tuberculosis, osteoblastoma. Third differential diagnosis for night cries or night pain is ankylosing spondylitis. Okay? Yes. Lumbar spine movement in all directions are restricted. Gradually, there is loss of normal lumbar lordosis with the development of thoracic kyphosis and forward bending of the cervical spine. Okay? Yes. You see, patient may develop plantar fasciitis. Patient may develop endoachilles tendinitis. Costochondral and costovertebral joints are involved at the end. So what happens? Chest expansion is greatly reduced. This is again a criteria. Clinically, I had seen, no, always when you suspect ankylosing spondylitis, we will measure the chest expansion. Chest expansion is very much decreased. In about 25 to 30% of patients, hip joints are involved. The hip joints are painful and movements are gradually reduced. And extra-articular manifestations of ankylosing spondylitis are uveitis and cardiac abnormalities. What cardiac abnormality we can expect? We can expect a conduction defect. We can expect an aortic incompetence. Aortic regurgitation. Trauma is a cause. Apart from rheumatic fever is the most common cause. Trauma is the second common cause. Okay, then syphilis in olden days is a very important cause for aortic regurgitation, olden days, syphilis. Because syphilis, no, it caused dissection of the root of the aorta. So syphilis and ankylosing spondylitis from ortho side is an important cause for aortic regurgitation, dear friends. So rheumatic fever, trauma, syphilis, aortic regurgitation, ankylosing spondylitis, yes. And what other thing it can cause? Conduction defects. It can cause SA node block, AV block, bundle of His, wherever it is, conduction block, heart blocks, ankylosing spondylitis. At the end, in fully developed ankylosing spondylitis, the patient develops a question mark body posture. You see, this was taken, just an example thing. This was taken, the difference between these two, no, 10 years. 10 years later, patient had gone for a posture like this, and this is called question mark body posture. When a question comes, question mark body posture is seen in definitely ankylosing spondylitis.
Question 5. A 30-year-old male patient presented with complaints of a gradually progressive swelling around his wrist joint for 3 months. Given below is the image of the swelling on the X-ray film. What is the most likely diagnosis? Your options are. And the correct answer is osteoblastoma. Here's the explanation.
Osteoclastoma, this is otherwise called giant cell tumor. This is otherwise called giant cell tumor. Giant cell tumor. Osteoclastoma otherwise called giant cell tumor. The very peculiar thing is, the question is this malignant or benign? Because most of the time this is classified only under benign tumor. Under a benign tumor. But why I had given this under malignant tumor? See, even though it is benign, 3% of the individuals, it can show pulmonary metastasis. It can show you metastasis. And it's behaving very aggressively. So this you can't very clearly say this is purely benign, this is purely malignant. That is the very peculiarity of this osteoclastoma, otherwise called giant cell tumor. It classically arises from the epiphysis. Osteochondroma metaphysis, chondroblastoma epiphysis, chondromyxoid fibroma metaphysis, aneurysmal bone cyst metaphysis, unicameral bone cyst metaphysis, osteogenic sarcoma metaphysis, giant cell tumor epiphysis. And most common age is 15 to 35. The most common site is lower end of femur. Second site is upper end of tibia. So it is again knee joint. This is a disorder of knee joint. And the very peculiar thing, first complaint is swelling. Pain comes much later. Only when pathological fracture happens in osteoclastoma, patient is complaining of pain. Okay. The presentation, they say, sir, increased swelling, sir. Slowly it is progressively increasing. That's the complaint. Okay, so swelling first, pain next. Osteoclastoma, giant cell tumor. Very peculiar thing again, what I read, no, the first time I am reading a malignant, more common in females, slight female preponderance. Very peculiar. So far what we had seen, exostosis male, osteochondroma, that is exhausted male, osteogenic sarcoma male. Okay, this is one tumor, no, it is more common in slightly more female preponderance. That's what's given in the thing. So this can be picked up as a peculiar to fool us, no, because any bone tumor will say male. They may ask a question in NEET exam. Osteoclastoma is more common in male, female, equal sex ratio, none of the above. Okay, we should, okay, answer that as female, right? On palpation, this osteoclastoma gives what is called an eggshell crackling sensation. Osteoclastoma, it just gives an eggshell crackling sensation. Okay, good. And on aspiration, when you do a fine needle aspiration cytology, already I told you in bone cyst, this will show you only multinucleated giant cells, lot of giant cells, no hemosiderin. When hemosiderin is there with giant cells mixed with the giant cell, you are mixed with hemosiderin, it is aneurysmal bone cyst. Only multinucleated giant cell, no hemosiderin seen, it should be osteoclastoma or giant cell tumor. Now, you see X-ray shows a very classical feature, X-ray shows a very classical thing. The cortex is expanded and thinned, no periosteal newborn formation. See, the cortex is expanded and the cortex, you see, it's very thin cortex. Here you see the cortex is thick. Normal area, the cortex is very thick, this much thickness is there. Here it's very thin, thinned out cortex. And you can see lot of lobulation here. Okay, lot of lobulations here. So this gives a classical, I will erase this so that you can appreciate very well. This gives a very classical thing, and this is called soap bubble appearance. 10 lakh time repeated MCQ. Okay, soap bubble appearance. Right. So in case of osteogenic sarcoma, we had seen Codman's triangle sunburst appearance. Here it is soap bubble appearance. Very, very classical.
Question 6. What is the likely diagnosis for a 55-year-old woman who presents with lower back pain? Please refer to the provided radiographic image of her lumbosacral spine. Your options are, and the correct answer is osteoporosis. Here's the explanation.
Shows marked osteoporosis.
And what happens? The disc bulges. In osteogenesis imperfecta, what happens? The disc bulges. The vertebral body is weak because of osteoporosis. So the bulged disc from both above and below will compress the body of the vertebra. So this is a normal, see, normal vertebra, it should be square or rectangle like this. This is normal. Here, because of disc bulge, what happened? It has become like this. Yes or no? So this is called biconcave vertebra. Otherwise, this is called codfish vertebra. This is a codfish, a sea fish, very rich in omega-3 fatty acid. No, codfish, fish liver oil, cod liver oil. How many times we have read cod liver oil capsules, very rich in omega-3 fatty acid. We are consuming that regularly for general health. Yes or no? So the codfish, when you take skeleton of the codfish, the vertebra of the codfish is biconcave normally. So this is our normal human vertebra. Square rectangle. This is a real vertebra of a codfish. You're able to see it's biconcave, yes or no? Able to see that? So this is a real picture of a vertebra of a codfish. So exactly these vertebrae are becoming like a codfish vertebra. So this biconcave vertebra is otherwise called codfish vertebra. Okay.
Question 7. A 40-year-old patient presents to the emergency department following a road traffic accident. The radiograph of his pelvis is shown below. What is the most likely diagnosis? Your options are. And the correct answer is posterior dislocation of the hip. Here's the explanation.
So this is your acetabulum. This is normal position of the head. Okay, what happens in a dislocation? You see, this when it gets dislocated, your head is here. So this is a posterior dislocation hip. You see here, see this? Obviously, and the head appears only half. Head appears only half. Only this much is seen. The rest of the head you are not able to see. It is behind the acetabulum. So here is your acetabulum. So this is a classical X-ray of posterior dislocation hip.